Pain, not death, is the enemy of mankind. I'm Lori Drummond, and I'm going to show you how you can get rid of low back pain using Prudden Myotherapy. And once you learn how to use Prudden Myotherapy, you won't have to be afraid of living with pain. This is Dottie, and we're going to show you how to work on a partner. Most low back pain comes from trigger points in the gluteals. The gluteal muscles are larger, more powerful. They will pull on the lower back. To start with, we're going to do a triangle right about in the bulk of the muscle. If she had blue jeans on, they'd be right about where her back hip pocket would be. It's a broad muscle. There's no direction that the trigger points have to be erased in, and you can arrange your triangle depending on the size of the little body you have underneath you. Pick a point, any point in that triangle, put your elbow down. Now you're going to roll up onto the point and get your shoulder further forward of your elbow. And go ahead and relax into that point. When you find a sensitive point, you've got your trigger point. So once you've found the trigger point, hold that pressure for about 7 seconds. That is about what it takes to diffuse that point. Ease off of that. Pick a second point, right? It's still in that hip pocket. Elbow down, roll up onto your point, get your shoulder forward, relax into it. We're holding about 7, which is about what it takes to get rid of these points. There's nothing magical, but that's about what it takes. Come on up, find your third point, elbow down, roll onto your point, and relax into it. These points can contribute to low back pain, but they also contribute to leg pain, sciatica, and hip joint pain. Now we're going to do the outside. I'm going to have you bend your knee and turn slightly on your side towards me. That's good. We're going to find the outside. If she had on blue jeans, they'd be right about where the outside seam of her pants would be. Start just below her hip, elbow down, bring that muscle towards you. Roll up onto your point and just relax into it. These muscles have also a lot to do with pain on the outside of the knee, or if you're walking and you have a knee that gives out on you, come a little bit below that first point. If you find the hip bone, the trochanter, just come a little bit behind it and press in. On a scale of 1 to 10, when you're applying your pressure, you never want to go over a 7, so you are working in communication with your patient. Slide your leg down. We're going to come up to the low back. Find her spine. You're not going to press on the spine, but you can use it as a reference point. Here's her waistline. I'm going to come in between her waistline and her ribs. Put your elbow down and slide out to the outside of that rope-like muscle. You see how she's got a nice little ridge there? Slide to the outside of that ridge, and you're going to roll up onto your point. And as you get your shoulder forward of your elbow, that angles your pressure back towards the spine so you can trap that trigger point. These are the key points for low back pain from the back. Now to stretch these out, I'm going to have you turn on your side with your back towards me, and we'll do side lying stretch. Once you get rid of the points, you have to bring the muscle through a range of motion in order to re-educate the muscle to let go of its habit of being held in that shortened position and remind it to stay at its resting length. This is a side lying stretch. It's in all of Bonnie's books, as are the trigger points. Bring the knee up, stretch the leg out and about 8 inches off the table, and then put it down, relax. Make sure the knee is bent, otherwise it's not relaxed. One more time, bring the knee up. You want to do these exercises about 4 or 5 repetitions and at least 5 times a day. Go ahead and turn over on your back and slide to the opposite side of the table. For every back, there's a front. In myotherapy, you want to get at the opposing muscles as well as the area where you're feeling the pain, and also go adjacent because one muscle pulls on the next. You're going to find the top of the hip, put one thumb on top of the other, and we're going to get your thumbs out of the way, press deep, and wrap under that ilium, and come part way down, press deep, and away from you. So you're trapping those trigger points up against the ilium. And now if you step up towards the head, there's a little ligament that goes across to the pubic bone. We're going to press deep, and if you angle towards the outside of the knee, you're about where that ligament would be. And If we had just worked on this side, you always want to do both sides. You're going to go for the next point below that inguinal ligament, put your elbow down, and you're going to aim towards the outside of the opposite shoulder, press deep, and drop your shoulder so that the point of your elbow is aiming away from you and under that inguinal ligament. And to stretch these, we're going to stand towards her waist and lean right into her waist. If she's got low back pain, bend the opposite knee. The leg that you just worked on, we're going to drop over the edge of the table and just give her a nice little stretch. The reason you want to be here at the waist is because I have control. She can't go anywhere. I just lean into her. And a nice, easy little stretch. Bring that leg up. And to complete your session, you want to repeat the same trigger points on the opposite side. These are just a few of the key points to erasing low back pain. For more complete information on myotherapy, please log on to our website at bonnieprudden.com, where you'll find a list of the books, DVDs, and seminars where you can find more thorough information. And as Bonnie would say, keep fit, be happy.